Hello and welcome back to our IVF webinar tonight. We are back here. Sorry for being a bit late, but all is okay now. We are here, we are connected, and please just let me know that you can hear me. Hi, Dr. Elias. I hope you can hear me as well.
Hello, Caroline. Yes, I can hear you fine. Hello.
Fantastic. Thank you. Thank you so much for confirming this for me. Well, and I am your host as always. And tonight we have another topic to discuss. And of course, Dr. Elias will simply start with his presentation, and then it will be time for your questions. So I'm sure you have plenty of questions to ask. So remember, you can type them all in the chat section so that Dr. Elias can actually answer them for you and help you about, because we know right now you are not able to proceed with your treatments, and therefore we are simply here to support you, to provide you with some details. And of course, the doctors, our top experts, are here to discuss all kinds of topics and also answer your questions. And that is why Stronger Together initiative has been created, so that you can at least use this time to learn, to gather some more details before you will be ready, before you are able to go ahead with your treatments. And once again, let me just remind you that this initiative, this would not be possible if it weren't for our ambassadors and partners. All of them are right here on the screen. So huge thanks to them. This is again possible thanks to the partners and ambassadors as well. And right now we have another topic, as I've mentioned, and this is COVID-19 implication on fertility treatment. So Dr. Elias Tsakos, he is actually from Embryoclinic, which is located in Thessaloniki in Greece, and he's actually the medical director of that clinic. So he will start off with his presentation, and right after he will answer your questions. It's good to have you here, Dr. Elias. How are you tonight?
Hello, Caroline. I'm absolutely fine. It's 10 in the evening in Greece. It's quite warm. It's 19 degrees, so summer is just around the corner.
Sounds excellent.
We're very happy to share with you some exciting news and some exciting evidence about the COVID implications on fertility treatment. And I think it's about time to give some hope to our hundreds and thousands of couples all over the world who are expecting to hear a bit of good news with regards to their treatment.
Definitely. We are all waiting for some good news. So go ahead with the presentation, and right after, as I've mentioned, there will be your time for your questions. Ready to go ahead with it? Perfect.
Yes, I am. Yes, thank you.
Thank you.
Hello, everyone. It's a great pleasure for me to be with you tonight. It's been a long day for me. I started very early in the morning, so you have to excuse me if I stumble in my talk at some stages, but I should be fine. I'm very excited. I would like to reach out to each one of you separately in the Q&A section afterwards. But initially, I would like to share with you some knowledge and some updates on the COVID implications of fertility treatment. Okay, coronavirus is the virus, the official name of which is SARS-CoV-2, and COVID-19 is the disease caused by the virus. I mean, what is definitely with us, and it's going to be with us for some time, months, maybe a year or two, is this situation. I mean, the whole world today is experiencing this unprecedented epidemic, which became a pandemic very quickly. And we all have to accommodate and adapt into the new norm, into the new situation. And of course, fertility world wasn't left outside this implication. So the virus name is SARS-CoV-2. The disease is COVID-19. So someone who has the virus is very likely to develop the disease, although not always this is the case. And it all started at the end of 2019 in China. It only took about 2.5 months to become a pandemic, as declared by the World Health Organization, and it's now affecting most countries in the world, very near 200 countries with millions of cases, as I will describe later on. All of us, 4 months ago, we couldn't have imagined the situation and the new norm. However, may I stress that pandemias and epidemias are quite common in the modern world. May I say that there's still an ongoing HIV and AIDS pandemic at the moment, and that around about 12 years ago, in 2008, there was another pandemic of H1N1, which was another sort of similar virus to this present one. So, although it is devastating, and although the effect, the overall effect of the SARS-CoV-2 virus has been absolutely huge, however, the modern world is not totally unaware of such situations. Now, this is a map which was taken, it was a snapshot from Johns Hopkins 3 days ago. There was 2.8 million of cases at the time. This is like a real-time update of the cases in the world. So confirmed cases were 2.8 million and confirmed deaths almost 200,000. I can confirm today, I have the data here on my phone, that today's cases have gone up to 3.1 million, so more than 300,000 in 3 days. And sadly, the death toll has gone up to 217,000, so another almost 20,000 deaths in the world within 3 days. I think this is just indicating of how quickly this epidemic, this pandemic is spread, and how widely it's affecting the entire world. Now, on the left here, you can see the countries mostly affected by the virus and by the pandemic. And as you can see, the US is topping this list with almost 1 million cases. And of course, followed by Spain, and then closely by Italy, France, Germany, and the United Kingdom. And of course, here you can see also the similar unfortunate death toll of the virus. So it is a real situation. It is a real problem, and I think we have to accept it in a way so that we can adapt and accommodate our approaches and our lifestyle, and also our medical practice to this new norm, to this situation. Now, the situation in Greece, where I'm basically based, although my team and I do have an activity in quite a few European countries, including the UK. So hopefully and thankfully, Greece will still be on the low side of this list. So at the moment, there's just over 2,500 confirmed cases of COVID in Greece, and just over today's figure in terms of number of deaths is 138. So we've gone up by 8 deaths in the last 3 days. However, still Greece is one of the most fortunate countries, and this has been simply, in our opinion, due to the fact that early lockdown was instituted with businesses, schools, medical facilities, and IVF centers completely closing about 45 days ago. So now Greece is one of the countries coming out of this lockdown due to the major and the main reduction in deaths. So we have resumed some sort of service across the board of medical services of Greece, and that includes IVF services. And there's going to be a complete release. I mean, we had a Prime Minister speech yesterday, apparently stating that from the 4th of May, even non-urgent medical services should be restarted. And of course, this has hit the news. The Guardian wrote that Greece has been beating coronavirus despite a decade in debt. And the New York Times today had a very interesting article demonstrating exactly the same. And here you can see how we've managed to increase to keep the curve quite low in order for the NHS to be able to cope with the illnesses and the fatalities, of course, of the virus. And you can see here that from the earlier April, really almost about 25 days ago, we've been over the curve, over the top of the curve, and now we're starting to decline. Now, I'm not going to be very long explaining the obvious, which is that there's new norms now in everyday life, and there's new challenges affecting every aspect of modern living, and that includes, of course, health, work, social life, psychology, civilization, culture, politics, relationships, and of course, economy. So it's quite a devastating issue and challenge affecting the entire world. And I think we're all very well aware of that. Now, what's happening with the medical profession, and how is the medical profession across the globe managing to cope with this situation? I mean, one of the new situations is that, of course, over the last 45 days, we tried to keep an absolute minimum of physical contact with our patients. So there was very minimum amount of pre-scheduled appointments. I mean, in my department, we are involved not only with fertility and IVF, but also with general gynecology, with obstetrics, and with breast care, dealing with both benign and malignant disease. And equally, in our gynae department, we do care for benign and malignant gynecological problems. So, of course, we had to prioritize alongside the guidelines of the European Society of Human Reproduction, and also, of course, in line with some UK guidelines issued by the Royal College, and also from the American societies as well. So we have kept open. I mean, we are doing only emergency outpatient work, only emergency surgical and theater work, and of course there was no accompanying persons, no children allowed to visit. There was a lot of patient questionnaires in order to identify who is at risk, in order to be able to screen them more or isolate them if need be. We used the face masks quite early on, despite the difficulty in getting hold of face masks, and of course temperature measurement, hand washing, and social distancing. By doing this, of course, we maintained the high levels of safety for our patients and also for our staff. There was very strict, even during the quarantine, even during the lockdown, there was very strict procedures to protect the staff by, of course, doing all the questionnaire, all the temperature taking, all the screening at regular intervals, and of course, risk management and quality control of all our services in order to maintain open. During the last 2 months or so, there's been a lot of new data, a lot of new evidence, and of course, a lot of new questions that haven't been fully answered with regards to pregnancy, delivery, and breastfeeding. The initial reports are quite optimistic, and it seems that the disease severity in pregnancy is matching the non-pregnant individuals. In fact, this has been posted on the Royal College of Obstetricians and Gynecologists website, so we're very well aware of this situation. And although there's a lot of unknowns about the effect of coronavirus on pregnancy, at the moment the FRCOG and most of the scientific societies across the globe do share the same attitude towards advising pregnant women to be careful, of course, but they need to be reassured that the disease severity matches the non-pregnant individuals, healthy individuals. There's been, to my knowledge, there's been no maternal deaths until now, which is quite reassuring. However, we must bear in mind that in pregnancy, a lot of women may be asymptomatic, may have very mild disease, may have very mild symptoms, and they may even be negative to triage. So by applying the questionnaire, by taking the blood pressure, by asking them about possible contacts, travels, and all that, that may still not identify the ones who are infected. In view of that fact, and in the light of a Lancet paper published about a week ago, which identified roughly 13% of asymptomatic people undergoing surgery with a high complication rate. In our hospitals in Greece, we instituted routine PCR testing on all pregnant women admitted to labor, and this has become the norm. ever since 45 days ago, since the lockdown. Thankfully, we haven't identified any positive women coming into labor. We had one suspicious case who was referred to a COVID reference center, but then eventually she was proven to be negative as well. So personally, I have no experience in managing pregnancy affected with COVID virus. However, we are very happy to continue screening even asymptomatic women with PCR before they enter labor in order to protect themselves, patients, protect their unborn child, protect the neonate when the neonate is born, and of course protect the staff, the attendees, members of the family, and the facilities. And of course, this has been widely discussed in various institutions, and I think quite a few facilities are considering applying that. Having said that, this is not always easy or applicable or feasible or logistically easy to apply, but if it is possible, then we would give some extra reassurance to our patients entering labor. Now, with regards to vertical transmission, although there was initial reports that this is not happening, there was also quite a lot of concern with regards to the possibility of this happening, and the general scientific knowledge at the moment is saying that there is a low chance, but it cannot be ruled out completely. So we have to be very well aware of that. And of course, we have to keep an open eye on the new evidence starting to emerge. Now, with regards to neonates, again, there's been a few case reports on neonates affected by COVID-19. It is not clear at the moment whether that happened in utero or whether it happened intrapartum. And again, we need to be very cautious, and we require more evidence before we come to any concrete conclusions. Now, with regards to breastfeeding, it's quite encouraging, the data at the moment. So breastfeeding is encouraged with appropriate protection, of course, with regards to masks, hygiene, and so forth. So there's a lot of unknowns with regards to pregnancy, and all women planning to undergo IVF or fertility treatment or having undergone that, they have to be aware that there's a lot of unknowns with regards to the effect of the virus on the first trimester. Of course, we're quite familiar with the adverse effects of the fever, of high temperature on the fetus in the first trimester. And of course, we're quite familiar with the adverse effects of the SARS-CoV-1 and the MERS virus in the first trimester of pregnancy. However, more data is required, and thankfully this is going to be possible to have all that data collected in the next few weeks. Now, what happened to fertility care, IVF, and ART clinics all over the world? The reflex action, both by ESHRE, the European Society of Human Reproduction, the British Fertility Society, and the American Society of Reproductive Medicine, was to close the clinics until we had evidence on how we could ensure safety, how we could ensure that the quality was kept at high levels, how we could ensure that we wouldn't divert any resources from the general hospital care to COVID patients and all that. So in Greece, the clinics have been closed for about 45 days, and to my knowledge, this has been the case in most of the European Union countries, including the UK. So we had to finish off the cycles already started. We were advised to, and we advised the patients in view of the uncertainties, to freeze the embryos, so we didn't perform any embryo transfers. And in the last 45 days, most of us didn't perform any cases unless there was an absolute emergency, and that was simply cases of fertility preservation for cancer patients. Now, what's the situation between fertility and IVF? Now, the good news is that there's no report at the moment that the virus is transmitted into the follicular fluid or the oocyte or into the male reproductive organs or sperm. So there's been a very nice report published or pre-published. There's a lot of quick publications these days, so we have the opportunity to see evidence science before they're officially published or accepted for publication. But there's been a wonderful paper on fertility sterility, one of the highest scientific journals across the Atlantic and across the world, basically proving that there was no presence of the virus in a sperm of affected males. So that was quite an optimistic initial finding, and let's hope that this will be confirmed with further findings. Now, there's a big debate as to whether pregnancies should be deferred. I think most of fertility specialists do agree that fertility patients are urgent. We don't think that they should be classed as non-urgent, because there is an urgency in most cases where we perform fertility care, either because of advanced female age, or because of planning, logistics, psychological consequences, and so forth. And there's no reason for natural pregnancy to be deferred at the moment, and there's no such guideline in the world. So it doesn't sound very logical to us once we do have the evidence of how to reopen the clinics and how to reinstitute safely following specific guidelines, why we could not start fertility treatment. I mean, the European Society of Human Reproduction issued a few days ago some guidelines as to how to reopen, how to triage the patients, and how to ensure safety and quality in reproductive care in the era of COVID. So at the moment, fertility treatment in the UK is paused, as far as I'm aware, and it's also paused in the majority of European countries. However, some countries are now reopening. I understand that Denmark and Germany have restarted fertility services. We had an announcement by our Prime Minister that as from Monday, the 4th of May, all of non-urgent outpatient departments will reopen, or all non-urgent theatre cases and surgical procedures will start to be performed as we're coming out of the lockdown. And of course, we are part of the European Society, so we're expecting our own authorities to issue a statement in the next few days with regards to the absolute details of reopening. And the overall feeling in Greece is that this will be in line, of course, with the European Society of Human Reproduction. Now, pausing fertility treatments and pausing the operation of fertility clinic has caused an immense psychological burden on our patients. I mean, most of us, including our team, we've been around the clinic, we've been available, we've been using the internet, the telephones, all the social media platforms, communicating with our patients. I would like to apologize to our patients for not being able to treat them. I would like to share with them my understanding and my feelings of grief and of sadness and of uncertainty in the light of the new situation. We've been unable to provide treatment, but I think that was the right thing to do, because we all complied with the international guidelines, and that was for the safety of the patients. And equally, it is our duty now to ensure that when we restart, this is done in an organized manner, in a safe manner, following and respecting all the modern data and all the scientific evidence on safety and quality. Now, I can give you a small outline of the ESHRE guidance. So there's been a lot of discussion, there's been a working group, there's been active discussions across the board of the members of ESHRE. So there's 6 main guidelines put in place. I'm not going to go into vast detail, but all I'm going to say is that there's going to be a triage questionnaire on staff on daily basis in order to identify the ones potentially at risk. In case of any suspicion, ESHRE is recommending the antibody testing. However, I understand there's a lot of debate on the antibody testing and with regards in particular with regards to its accuracy. In our country, in Greece, I think most of IVF clinics that I have been in touch with, they will probably start instituting the PCR, the genetic testing, which seems to be more accurate and more accurate, basically, and quicker sometimes, in order to identify the asymptomatic patient. May I stress here that if somebody has symptoms, then by all means they're in this category, so they need to be tested. In my opinion, the big problem is here. The big problem is in patients who are completely asymptomatic. So patients who may be carrying the virus without being aware of that. So we are discussing now with our infection control teams and with our infection consultant colleagues in Greece and abroad, and we're very seriously considering to institute routine testing on asymptomatic, on everyone who's going through IVF, and testing not with the antibody test, which is not that accurate, but testing with the PCR testing, either just before starting the procedure or at some stage before the egg collection, to ensure that this patient is healthy and not a carrier of the disease, of the virus. And equally, what we do, of course, for our patients, we do for our staff, just to ensure staff are healthy and staff are continuing to care in a quality manner. Now, there is a recent guidance by the Human Fertilization and Embryology Authority in the UK, which is basically stating that there are some conditions under which there's going to be a start of the treatment. That was only issued 4 or 5 days ago. So basically, there are some specific conditions under which fertility treatment and care will start and be instituted in the UK, hopefully in the next few weeks. The American Society, of course, they also issued a statement. We managed to have a glimpse of a pre-statement on the 27th of April, and again, similar guidelines have been put in place in order for treatment to be started. So, with regards to surgery, gynecological surgery, breast, fertility, and cancer, again during the lockdown, during the pause, we stopped almost all of our services, including even some cancer cases that we classified as non-urgent. We classified as non-urgent in terms of weeks. And now, of course, we're rescheduling those cases for next week. And equally, fertility investigations were paused and fertility surgery with regards to endometriosis or ovarian cysts or adhesions and so forth. So all of this is restarting in Greece on the 4th of May, so next week. Right, I will finish by giving you 10 tips. These are not my tips. These are tips inspired by Hippocrates, the father of modern medicine. 8 of them were inspired by Hippocrates, 1 by Leonardo da Vinci, and 1 by the Greek folk. So may I start? So first of all, please comply with your national guidelines. I mean, there's a lot of discussions as to what is the best approach. We're all quite familiar with the UK model, the US model, the Swedish model, the Greek model, and so forth. My advice to all of you would be to please comply with your national model. The leaders in every country, they know much better than we do. They have more data, they have more experience, and of course they have a better plan. So let's stick to their plan, and let's hope that it's the right one for us. And according to Hippocrates, even if it sounds extreme, this may be necessary because extreme remedies are very appropriate for extreme situations and diseases. Now, simple things like washing your hands are very important, so wash your hands often and avoid touching face, nose, and mouth. In Greece, we have the saying that cleanliness is what makes you half oil. Drink plenty of fluids, and of course that refers to water, not any fluids, no alcohol, because water is the driving force of all nature, according to Leonardo da Vinci. The lockdown might be an amazing opportunity to improve your lifestyle, to reduce your stress, improve the nutrition, understand what nutrition is. Most people think, including myself up until a few years ago, I thought that nutrition and diet is more or less the same thing, which is not. Cut down on smoking and alcohol, and let food be the medicine and medicine be the food, according to Hippocrates. A wonderful opportunity to exercise. This is still allowed once a day in the UK, as far as I'm aware, once a day in Greece. I think that's from next week. We'll be doing it twice. To take our own back. So walking is man's best medicine. That was identified by Hippocrates 2,500 years ago. Time to boost your health and boost your immune system. And the wise man should consider that health is the greatest of human blessings. Again, Hippocrates. This is the time where we just fanatically look on the internet, look on our tablets, our phones, and so forth. But let's keep that to a minimum because it can be harmful. As Hippocrates said, everything in excess is opposed by nature. This may be the time to start a new project and allow the natural healing force within each one of us, which is the greatest force in getting well. Let's not forget that, the natural healing force within each one of us. This is the time to keep in touch with your medical team so that you have a kickstart, you have a head start for when the reopen happens. So most of the medical teams, all of them, they're there. They have plenty of time because they don't have real patients. So they do have enough time to dedicate on the virtual patients, on the e-patients, call them whatever you wish, and time for e-consultations, time for discussions, time for webinars, for meetings, and so forth. Keep in touch. This is the time to get educated. This is the time to ask questions, to find answers. This is the time to reflect. And this is the time to also appreciate the difference, according to Hippocrates, of science and opinion. Because science is knowledge and opinion is usually ignorance. And of course, remember that time is the best medicine. I mean, whatever seems to be impossible now will probably be possible in a few weeks and a few months. Don't lose faith, because healing is a matter of time, but it's also a matter of opportunity. I would like to finish here by sharing with you a new norm, a new situation, and a new fact. Up until now, we've always thought, as medics, as in the medical profession, we thought that our duty is to preserve, protect, and create life. However, now we just discovered, I think all of us, if not most of us, if not all of us, we discovered that we shouldn't just be saving lives. We should be saving hope, because that's what the world is needing more than anything at the moment. Thank you so much. Thank you.
Perfect. Thank you so much for this presentation, for those tips as well. That was definitely spot on. Lots of useful information. So thanks a lot for that. And well, it will be time for our Q&A session. But the first comment here is actually stunning presentation from a patient of ours already. So thank you so much for that. And well, are you ready for more questions right now?
Absolutely, yes, I am.
Perfect. So let's go for the very first question right here. Is it advisable to start preparing for a test now, since it is most likely that easing lockdown is imminent, or is it advisable to wait until all lockdown is uplifted?
Sure. Absolutely. This is the best time to start preparing for the reopening. As we're all aware, it may take quite a few weeks for all the tests to be completed prior to IVF. And more often than not, if an issue is identified, then treatment may be required. For example, some vitamin deficiency or some thyroid or hormonal problem that needs to be corrected, and so forth. So absolutely, yeah, please do start talking to your medical team now. do start making a plan now, asking questions, getting answers, making a plan, understanding your situation, and also getting all the power you need, not just physically, but also emotionally and spiritually. So this is the best time to use the lockdown as an opportunity for empowerment and preparing yourself for the next step.
Excellent. Thank you so much again for your question, as well as your answer for this, and your encouragement as well. And let's get to the next question. How will the vaccination affect fertility treatment? Will it be enforced? And what about the risk before a donor transfer or while pregnant?
Sure. Okay. I don't know is the answer. I hope there's going to be a vaccination soon. This is not 100% certain. Uh, the world has not discovered vaccines for every single disease and condition, as we all know. There's no vaccine for HIV. There's no vaccine for hepatitis C. There's no vaccine for SARS-1. There's no vaccine for MERS. So it's not certain that the vaccine will be available anytime soon. We hope it will be. We hope it will be safe and effective. There is a race. I mean, there's a scientific race. I have to share with you that all of us in the medical profession, in the last couple of months, 3 months, we've been under heavy scientific bombardment as to what is the effect of this new situation into our specialties and into our everyday practices. So we don't know the answers. So I don't know how it will affect fertility treatment. I would hope that a vaccine similar to the seasonal flu vaccine will be available, hopefully before the end of the year. But even if it's available in the beginning of next year, that's still good news. And hopefully that will reduce and that will transform the pandemic into an epidemic and into a seasonal flu type problem. Of course, may I share with you the fact that even with the standard vaccine for the standard flu, as you're probably aware, most people are not happy to proceed with vaccination, but that's another issue. So hopefully, I would hope that the vaccine will be available, and I would hope that that would liberate the world from lockdowns, partial lockdowns, and so forth. Now, what about the risks before donor transfer or while pregnant? As I explained previously, I think we need to make sure that before a patient has a transfer, whether it's own eggs or donor sperm, I don't think it makes a huge difference. But that person, the carrier, the potentially pregnant woman, they have to be fit and healthy. They have to be clear of any risk of being an asymptomatic carrier of the virus. And of course, I'm not the one who is going to dictate guidelines for the clinics in the world, but definitely in my clinic, we would ensure that we have document of that by means of the most robust test available at the moment. And at the moment, the most robust test seems to be the PCR genetic test. So
Okay.
once we've ensured that, then of course we would minimize the risk of transferring a pregnancy into a carrier. Now, in pregnancy itself, we would consider that a pregnant woman is a high-risk woman in contracting the virus, as they are in contracting the seasonal flu virus. We advise all our pregnant women to be inoculized, vaccinated against the seasonal flu, and of course to be extra careful.
Okay, fantastic. Thank you so much again for that. We are definitely waiting for that vaccine to be, so we can definitely move on. And well, we need to wait and be positive, as you said. Thank you so much for that. Another question is up right here. So when you reopen, can UK citizens fly to you for treatment? Will a letter be issued so we can travel for medical reasons?
Well, to be honest, I'm dying to fly to the UK myself, so I will find out for myself and share my experience. This is the longest I've been away from the UK. I haven't been. I mean, UK is my second country, as most people know. For me, it's also very difficult to be away. So we don't know is the answer. We don't know. There's a lot of discussions at the moment. I mean, as you know, all the borders are virtually closed at the moment in Europe. Unless you're returning home, it's not easy to travel anywhere. We don't know under which conditions the flights will be allowed again, or whatever the road travel or the train travel. There's been a lot of discussions about a health visa, which means either a triage questionnaire, similar to the one that we will be instituting for patients, taking the temperature, but also there's discussions about the possibility of performing diagnostic tests on patients traveling, either by means of antibody testing or genetic PCR testing. So we don't know. We don't know. It may be a letter, it may be a GP letter, or it may be a self-declaration. We don't know. I think we will find that out in the next few weeks, in my opinion. We have very concrete information from our government here that international flights will reopen middle of June, even earlier. As I'm aware, and as we have been told by our Prime Minister yesterday, the idea of reopening services is that everything will become gradual, will reopen gradual. So the plan is to reopen about 10% of businesses, and thankfully non-urgent medical businesses is part of that 10%, and then evaluate the effect. And schools are reopening also on the 11th of May in Greece. And then evaluate the effect of the reopening onto the general epidemic trend, and then take it further. So if everything goes to plan, I would hope that international travel should be allowed from 15th of June at the latest.
Yes, let's fingers crossed that it's that how it's going to happen. Okay, thank you so much for that question, as well as your answer to it. Okay, the freezing of embryo costs are for a year. If this has been delayed for several months after the deadline due to IVF clinic closure, is there plans to delay charges to extend another year?
Another, I don't know. I'm sorry about this. I don't think this is an issue that I think, well, definitely our clinic we haven't come across yet. So we will have to discuss. But I mean, in general, the feeling is that we're partners in this amazing loss. So the general feeling of the clinics is that we would try to be as understanding as possible. However, one has to realize that apart from the, of course, the immense psychological stress of course, patients, families, siblings, carers. There's been an amazing emotional and psychological and also financial stress on clinics as well. So, this situation is not nice to anyone. And I don't think anyone has escaped any of those consequences. However, I understand that all clinics, we do have a lot of understanding, and we're very happy to discuss individual situations. So there's no concrete decisions in place, but I'm sure there's going to be a lot of understanding for all our patients in order for each one of us to show, solidarity and show respect to each other's individual circumstances and problems.
Fantastic. Thank you so much again for that. It's definitely reassuring. So thank you. And there's another question. Are you doing online Skype consultations so patients can get ahead of the field?
Sure. I mean, my clinic, my team and I mean, we've always been traditionally offering free online consultations to our UK patients. So free initial Skypes are still available. And we're seriously overbooked, but don't worry, we work hard and 10 in the evening is normal time for us to book appointments. So yes, absolutely is the answer. And of course, we also offer proper full online consultations for patients who wish to get on with their treatment without initial appointments also. And I think most clinics are doing the same. So there's a lot of work that could be done online, and we encourage patients to take advantage of that.
Fantastic. Again, thank you so much for this. And now, at my age, 49, 48, time is of essence. Do you have a waiting list?
Do we have a waiting list? The answer is maybe. Maybe. Depends on the type of treatment and depends on the individual requests. Can I tell you a little bit about how we have planned to work around this challenge? Since the borders will not open properly before the 15th of June, we have now prioritized all the patients who canceled because of COVID. They will be on top of our priority list. So we're hoping to work with the backlog of our local patients, of the Greek patients, from reopening up until the 15th to the 20th of June, and then from middle of June onwards, we will give priority to our international patients, starting from the ones who canceled the treatment, who had planned treatment, and then of course going further to the ones of advanced age, like 48-year-olds, 49-year-olds, 49 and 11 months-year-olds, and so forth. Now, a good piece of news is that although the age limit in Greece, as in most European countries, is 50 for the female partner, we had a letter issued by our Greek regulatory body, authority, that this limit could be extended to 50 plus a few months if treatment has been cancelled because of COVID. I think this is only the beginning because there's a lot of talks in Greece. There's been a lot of talks in the last couple of years in order to extend the upper age limit for the female patient to the age of 53. So that's another piece of good news.
Yes, definitely. Excellent news indeed. There are so many patients that were already worried that they will not be able to proceed with their treatments as they will turn 50. So definitely good news. Fingers crossed this is going to be actually official pretty soon as well.
If I can be a little bit more specific also for this 48-year-old Patricia. Hi, Patricia. Basically, depends on what treatment you would require. So if you would require egg donation, for example, and if you would have standard characteristic requests, then normal egg donation waiting list is no longer than 6 weeks.
Okay, perfect. Thank you so much again. And let's go to the next question. Which institution is actually deciding about when IVF is again allowed? Does it depend on individual countries' legislation?
Brigitte, yes, absolutely is the answer. I mean, yeah, the institution in the UK is the HFA, the Human Fertilization and Embryology Authority. In Greece, we have a similar institution, which is in line with the European Society of Human Reproduction. So the regulatory authority, the regulatory body of each country has the absolute responsibility to decide on timings and decide on conditions under which we reopen. And of course, the General Medical Council of its country has a huge say. I mean, in Greece, we're very fortunate because we have a very active General Medical Council. They have been amazingly active. Both the local GMCs, but also the national GMC has been amazing in supporting, informing, and spreading information. I mean, they even distributed personal protective equipment to each one of the individual 80,000 odd doctors of Greece. So, yeah, the General Medical Council, together with the fertility institution, are responsible for issuing the guidance.
Okay, perfect. Thank you again for this. And now let's get to the next question. So, if the donor is a carrier of COVID-19 and is not detected after the test, does the embryo will be affected by the virus as well?
Right. Okay. I would hope that no donor and no patient would be misdiagnosed as negative, uh, and I would be quite confident in that. I mean, at the moment in Greece, the overall case rate overall is 1 in 300. So there's about 3,000 declared cases. Even if the actual cases are about 30,000, that's about 1 in 300, which is very, very low. However, if we couple that by performing the PCR, which can be very, very accurate, even in asymptomatic patients, I think the absolute chance is extremely slim, if not non-existent. However, even if that's the case, the evidence today is saying that the virus is not passed on to the egg and onto the embryo.
Okay, thank you so much again. There's another question we might know, I'm not sure. How will treatment IVF donor be affected after Brexit and at the deadline?
Yeah. Well, I wouldn't worry too much about Brexit in Greece because, as you're probably aware, Greece and the UK have very, very strong ties, very well, of course, communicating and collaborating governments and so forth. And I understand that Greece has been the first country that basically declared that there's going to be no difference in the status of either Greek citizens in the UK or UK citizens in Greece and so forth. Now, with regards to IVF and donor treatment, no effect whatsoever. There's going to be no effect whatsoever. The only slight issue may be in the case in which embryos or genetic material needs to be transferred between the countries. And up until now, well, as you probably know, transportation of genetic material, so if you have sperm in the UK or embryos in the UK, if you wish to transfer them before the Brexit, the official Brexit, within Europe, you need no special license. So you do that as if you're transferring between a London clinic and a Manchester clinic. After Brexit, we would need to have a special license by the authorities. But that again shouldn't be an issue. But again, transferring genetic material is not very common. But even if that's the case, it could happen with a special license.
Okay,
So
thank you.
no real effect.
Perfect. That's good. That's too good to hear as well. There are like 2 questions left. So just wanted to remind everyone, if you have any other questions left, just go ahead and type them all in. We will be slowly finishing, but of course, I definitely want to give you time to type those questions. Okay. There are some also comments, but I will get back to those comments after the questions as well. Okay, and now let's get to the next question. How long does it take to get the results from PCR? Would this be done by the clinic or will it be a requirement before traveling, or how many days before a donor transfer would be needed to attend in advance?
Sure. I mean, as I said before, there is a chance, there is likelihood that some sort of testing might be required before you travel. And there's a lot of talks between the governments at the moment before they allow international travel. So that would be either PCR or antibody testing. Now, once someone is landed and they are attending for treatment, again, there's ideally one should do PCR before they start treatment and one before the egg collection or the embryo transfer. However, because of the cost implications, we are now in discussions with our scientific authorities and with the scientific board of our hospitals in order to identify which is the best time to do it. I think at the moment it seems that probably the best time to do the PCR testing is just before the egg collection. Results take about 12 to 24 hours to come out. So maybe the day of trigger might be the ideal time. And if it is to be performed once. Let me just explain a few things again. PCR testing is valuable may be valuable for asymptomatic patients. If somebody has symptoms, then they will definitely have the full check, the full screen, the antibody screening and the PCR testing. And of course, if there's suspicion, then the treatment will not go ahead. So we're only talking about people with no symptoms whatsoever. Now, if you do the PCR, say at the beginning of the stimulation or at the beginning of the preparation for the embryo transfer, if it's negative, for example, and somebody develops symptoms, then of course you will know a little bit later. So, in my opinion, if we are to choose one point of performing the PCR, that should have to be just before the trigger, on the day of trigger, in order to make sure that at least uh, on the egg collection somebody is healthy. And of course, when you consider whether you transfer or not, you have tested and you have found them healthy. So that is the most likely scenario at the moment. Having said that, the X-ray is not suggesting any of that at all. So I think if we are to do PCR, that would be slightly over the top. However, in my opinion, I don't think that we should be risking, at least until we have more evidence. And of course, the antibody testing, that might give us some solutions as well, because as you're all aware, the antibody testing, if it shows IgG positive, in other words, if somebody has been through the disease and if somebody has immunity, then that might be the passport, if you like, the health passport, not only to travel, but also to have IVF and pregnancy with no particular danger.
Excellent. Thank you so much for that. It seems that it is our last question. However, it is like a final call for your questions. So if you have any left, go ahead and type them all in. And now let me go to the question. When do you think we can start to contact the courier's company to arrange the shipping of our embryos? Are any of such services working now? Can you recommend any safe courier you work with or have experience with?
Okay, the question is, where would you like to transfer your embryos to? If you're transferring the embryos within the UK, then there's no deadline. You can do it at any time. Always my suggestion is to ask the clinics involved. So if you're transferring embryos within UK clinics, just ask the clinics, the receiving clinic or the clinic of origin within European Union. I would do it as soon as possible, Gosia, because it's going to be much less complex before the official Brexit. Courier companies, they do work as far as I'm aware. So again, ask the advice from your clinics. I mean, we all have some associated genetic transportation companies, and of course, so you can find them on the internet as well. If you type biological couriers or genetic material transportation companies and so forth. But it's best to get things done before official Brexit, because there's no need for official license for that. So logistically, it's equally easy to organize than compared to transportation between UK units.
Excellent. Thank you so much for that. Someone is typing, so I just want to make sure that we have all questions answered. So, okay. Yes, okay. This is like a shout out already. So I guess we will be slowly finishing. And there are some very nice comments already. So I just would love you to see it. It's for you. Thank you very much for the great presentation. There's another one, a bit longer one as well. Brilliant presentation, packed with useful and relevant scientific information and addressing the human aspect at the same time. Indeed, a good time for empowering and building of hope. Thank you for that. And as you can see, plenty more coming. Oh, sorry, there is something like a question, right? Will clinics issue a letter to allow travel in case travel insurance doesn't cover? Do you have anything that you could add?
I don't understand the question, actually.
A letter to allow travel in. I believe that it's about traveling for the treatment. Let me just have a look if the patient has been able to add something. Travel insurance won't cover FCO limits. could you just let us know what you mean exactly? Okay.
Yeah.
Just let's wait a bit.
Sure.
Okay, here it is.
Foreign common advice against travel. Yeah, I would suggest to wait for a few weeks. I mean, before the end of May, I think all of this will be lifted and new guidelines will be put in place. But absolutely, yes is the answer. I mean, we had a couple who from Germany, they traveled, they really wanted to travel even during the lockdown. So we issued a letter. Then the letter goes into the relevant embassy and they issue some sort of travel documents. However, the situation, if somebody is dying to travel at the moment, is desperate to travel at the moment, despite the restrictions, then they have to be quarantined for 14 days. I mean, we have a couple from Germany who insisted on traveling so that they're here when the lockdown is lifted and they're quarantined in a lovely flat near the clinic for 14 days, waiting for the reopening next week. So yes, it is possible with the letter.
All right, excellent. Thanks so much for confirming that. And one of the patients is asking if you could name any courier service companies for transport you work with.
Well, I probably couldn't because I wouldn't like to sound commercial in advertising. However, please feel free to email me, and I'm sure my coordinators can send you a list of relevant companies.
Yes, of course, totally understandable. Here's the link also if you would like to get in touch with Dr. Elias and his team. All you need to do is just click on that link and there will be ask your question. All those requests, all those questions will be forwarded straight away to the team. So go ahead and do it. And thank you so much for joining our initiative, for joining us tonight, for your time. I know it's quite late there, so huge thanks for being able to just simply be here with us and for all your answers. As you can see, more and more of good feedback right here.
Sure.
So
Thank you very much. And just a few words. I mean, all for all of you amazing people out there. I mean, don't lose hope. This is only a temporary stop. Things will start again, and I think this has been useful for each one of us here, each one of us medical professionals, to understand all the emotional and the psychological impact that any delay can give to our patients. And I think, if anything, it made us understand more this amazing effort that all of you are making. So please again accept my sincere apology for this stop, but we were obliged to do that. And please take a personal promise on behalf of the fertility community that we were all made, I think, softer and more humane after this, and we're all waiting to treat our wonderful patients with the most sympathetic and scientific but equally humane manner.
perfect summary, I would only say. So nothing else to add, really. This has been perfect what you have just said. So huge thanks for that. And just let me remind everyone that this has been recorded, and you will have a chance to watch it with the link I have just sent you a few minutes ago as well. So you just need to wait for us to upload it, and you will have a chance to watch it again. And remember that all of our events can be found on myivfanswers.com. You can stay up to date. Just follow us on Facebook or Instagram, or follow our YouTube channel, and you will find everything there. And again, thank you so much, everyone, for joining us, for your questions, for joining our events over and over again. We will be back here tomorrow at 6 p.m. UK time and also at 8 p.m. UK time. So plenty more of events are coming. Also, I can honestly say that we will. Our Stronger Together initiative will be also available throughout whole May. So there are definitely lots of events coming up soon as well. Again, Dr. Elias, this has been wonderful. Thank you so much. Have a lovely night. And I hope we can do it again.
Thank you, Caroline. Thank you, everyone. Thank you.
Thank you. Bye.
Bye-bye.